I'm Roger Mann. I'm an orthopedic surgeon, and I'm here to discuss today ankle arthritis. Arthritis of the ankle occurs after the cartilage in the joint has been worn off, secondary usually to trauma. The arthritis of the ankle joint looks similar to the x-ray that you see behind me, in which you can see there's either a tilting of the joint or a collapse of the ankle joint. In the past, an ankle fusion has been used most frequently, but now there are devices on the market that will allow you to replace the ankle, which restores the motion, very similar to what you see that have a hip or knee problem, where they get a knee or hip replacement. The STAR ankle prosthesis is the only prosthesis in the United States that has undergone an FDA pre-market approval study. This was done over a 7-year period. It included 156 patients that were studied during this period of time. There is no other prosthesis in the United States today that has undergone the FDA pre-market approval. And the reason this was necessary is the fact this has a mobile bearing, which decreases the stress across the components compared to any other prosthesis that currently is on the market. This x-ray demonstrates what the prosthesis looks like once it's been inserted into the ankle joint. What we see is the flat surface of the tibial component, which has been placed in this way. You can see the little barrels there. The bone grows into those barrels, anchoring it. The talus is placed over the talus. It has a concavity to it, and again has a surface where you get ingrowth. Following this, the polyethylene spacer, which has a concavity in it, you can see about like that. That matches the groove in the talus so that it will glide this way and track on that. The component sits on top of the polyethylene, and that allows for motion to occur in this plane. So this is reproducing the ankle joint motion of dorsiflexion and plantar flexion, as well as transverse rotation. The STAR prosthesis is the only prosthesis that the FDA has approved in this country that allows for all of this motion to occur. So that the true motion of the ankle, which is up and down this way, as well as transverse rotation this way, this is all accommodated for by this prosthesis.
Hi, my name is Jim Reynolds, and I am a volunteer at the Tech Museum in San Jose, California. At the Tech Museum, we have a space where we call it the Life Tech Encounter. At the Life Tech Encounter, we have examples of different types of implants that can be done in the human body, such as hip implant, knee implants, and now, thanks to SBI, we have a model of an ankle implant. It turns out I can speak with a particular passion about the ankle implant because I now have one of those in my ankle. It all began for me about 2 years, I'll say probably 07, 08 time frame, when my ankle became extremely painful. I could get up in the morning and walk for half a day, but after that it was just terribly painful and uncomfortable to walk on. And toward the middle of 09, it became so painful that I decided I had to do something about it. I went to a doctor and an orthopedic surgeon, and she suggested that I have the ankle fused. And since that was the only procedure that was offered, I went ahead and agreed to have that done. I was 2 weeks away from having that fusion done, and I heard from a friend of mine that she had a friend who had had an ankle replaced. It was done in December of 09. I went into the hospital, was there for a very short period of time, about 2 days, during which the surgery took place. After the surgery, I was sent home in about 2 days' time with an anesthesia injection in the back of my knee, which apparently intercepted the pain coming from the sciatic nerve and made it comfortable for me to go home. I had that in there for about 3 days' time, and then after that, I was 2 weeks with my toes higher than my nose.
Following the prosthesis, patients are kept in the hospital usually 1 or 2 nights. Afterwards, they are kept on crutches for 2 weeks, not walking on their ankle. At the end of 2 weeks, they're placed into a cast that can start to bear 50% weight. 2 weeks after that, they can start to bear full weight, and at 6 weeks, we release them from the cast. They start to work at physical therapy. The procedure is very successful. Over the past 10 years, we've carried out 300 of these operations. We have followed a group of 80 patients for over 10 years with 92% success rate.
Since then, I've had great success. In the summer of 10, I actually climbed to the top of Vernal Falls at Yosemite National Park. And people who have done that know that you not only require some pretty good stamina, but you need a fine ankle to get up and down that hill. And I did that with great success. And also, I was able to go skiing just last weekend here in March of 11. It's fine to be able to do all these spectacular things like skiing and hiking, but I'll tell you the real relief is that I can get up in the morning and I can walk around that house without pain in my ankle. I would certainly recommend this procedure to anybody who has pain in their ankles and has trouble doing normal things. I find it's possible to walk up and down stairs, and this, of course, requires a great deal of ankle motion, both back and forth and twisting, and I have no trouble with that whatsoever. So I would recommend this surgery to anybody who has a lot of ankle pain.